Thank you. Thank you. Please sit. Let me first, before I say even thank you for that kind introduction, Gordon, I really was disappointed. I was actually shocked to hear that you would put your name on something like an award. I mean, how anybody could put their names on buildings or scholarships or awards or anything, I just don't understand that. And Ron, the one thing you had wrong, I do not put mayonnaise on it, but it's you want to toast the Wonder Bread, you want to melt a quarter-inch of Skippy Super Chuck on it, overripe bananas and burnt crisp bacon. It is phenomenal. Anyways, thank you for that kind introduction. This is the time of the year where some dream of winning an Oscar. Others dream of making it to the Final Four, or at least winning their office pool. But for the people in this room, I think it's fair to say it just doesn't get any better than the Research America Awards. And you can certainly applaud for these guys. Now, research can be quite an endeavor. There is no roaring stadium crowds or paparazzi. But the work promoted by Research America and supported by all of you here tonight saves lives, expands knowledge, and creates a better world for everyone. So to be standing in the midst of so many great scientific minds and incredibly generous hearts really is both humbling and inspiring. I pinch myself every time I'm in a crowd like this. I wonder what my father would have said if he'd lived. My mother, who is 102, I told her this afternoon I was coming here tonight, and she said, "That's nice, dear," and then went on to tell me what she had for dinner. My own passion for public health grew out of my work for my alma mater, Johns Hopkins, and its own distinguished School of Public Health. Al Summer there reminded me that we're all in this world together, and that we can save millions of lives, millions at a time, and that it is so much more humane and economic and moral to prevent rather than to have to deal with the results afterwards. Johns Hopkins inspired me to lend private support to the global public health causes that today face us, where we can make the greatest impact, including things like tobacco control and road safety, and also to make public health one of my top priorities. Over the past 9 years, we've advanced a broad agenda of public health issues in New York City, keyed to 3 core principles. Number one, we respect science. We based our policy in New York City not on what we want to be true, but what on the data tells us. That may not always be politically correct. It may not always be what the newspapers want, but is the only ways to be intellectually honest and to really make progress. Number two, we take seriously our duty to act on what we know so that we rely on the application of law as the chief instrument of public health policy. And number three, we invest significantly in primary and preventive care. One of the things we've done, for example, is $25 million to expand electronic health records to show doctors what patients are taking and where they've been before, and to make our doctors' offices and health clinic visits more valuable. We are here tonight with Tom Frieden, who was my former Commissioner of Health and Mental Hygiene and now runs Centers for Disease Control. And I think there are 3 people that really were influential in my life in terms of understanding public health and trying to make a difference. Al Summer and Tom Frieden and Tenley Albright, who has been a friend of mine for a while and really deserves a lot of credit. She's a board member of this organization, and she is the reason that I'm here tonight. And Tenley, I just wanted to say thank you. You should know that Al and Tenley are on the board of my foundation, so they keep us on